Hello students of PR2153 Cardiovascular System Science and Therapeutics. My name is Prof. Doreen Tan, and I'm here to really be introducing to you what to expect for this particular module. What comprises the cardiovascular system, you might say? Well, anything to do with the heart, the function of the heart, the output of the heart, the way the heart beats, as well as the circulatory system comprising of the arteries as well as the veins. So we're going to be having a good time with the cardiovascular conditions in this particular module. So I'm sure you've heard all about the integration of the sciences within a disease model. Let us examine a little bit more how all these are integrated for you in the setting of the CVS module in the prevention and management of cardiovascular diseases. Let's set the stage with biomedical sciences. And in this setting, they will come in and talk with you about what happens to the heart and blood vessels in cardiac failure or hypertension. But hey, before you learn about what's abnormal, you've got to first learn about what is normal. How does your body maintain blood pressure in the first place? Enter the pharmaceutical sciences, and they will be talking to you about what the difference is between the physical and chemical properties, say between the dihydropyridines and the non-dihydropyridine calcium channel blocker. You ask basic questions like, why do we use dihydropyridines in blood pressure control, but not so much the non-dihydropyridines? Then comes the clinical sciences, who will think about how to devise a care plan for a patient. With all these medications you have in your hand, what are the considerations when building a care plan for a patient with cardiovascular disease? They would also explore what are the barriers to compliance to statins, for example. What are the issues and considerations, the social barriers, the psychological barriers that a person might have when being told that they have a condition for the first time in their lives. Step in the system sciences, who will then talk about how to prevent the onset of CVS diseases in the first place. And we're talking about population health, keeping people healthy, and health advocacy. The other context of asking questions from the system's perspective is perhaps asking the question about whether Entresto is more cost-effective than lisinopril in heart failure. All of us know that Entresto costs something between $8 to $9 a day, whereas lisinopril costs you peanuts of like less than 20 cents a day. How can this drug be cost-effective? So, ladies and gentlemen, boys and girls, this is the excitement of CVS module. I hope that you enjoy it as much as I will. So, my goal is by the end of this module that you will enjoy cardiovascular medicine as much as I do, and you will see the challenge behind the multiple medications that we use in CVM. Number two, that your curiosity would have been cultivated for the rest of the pharmacotherapy topics that you're going to be covering, be it respiratory medicine or liver as well as kidney. And lastly, you will realize the humanistic aspects of care delivery. And this is really just the start of you seeing how as pharmacists we contribute to the total care to a patient, and why it's so important for us to consider many other aspects beyond just the biological aspects of a person's disease. It's also important to consider the values as well as the beliefs of your patient that you are dealing with. So, now meet your learning facilitators. I'd rather call them your learning facilitators than call them your lecturers, because gone are the days you're going to be expecting a one-way traffic where your lecturers are going to be giving you that information. So we are going to be turning the whole session around, and we're going to get you to prepare yourselves. And then as you come to class, it's going to be a very interactive session with your facilitators, and these are the people who will be interacting with you in this particular module. So I'd just like to bring to attention that there are two pharmacists that are from KTPH that will be helping out as part-time faculty, Dr. Grace Chang and Dr. Wee Xue Ting. Everyone else on the top row are the permanent faculty that you're going to be seeing for this particular module, and I'm sure you're going to be learning a lot from all these people over here. So the CVS module is arranged by themes. As you look at the weeks as they progress, week 7 all the way to week 13, in blue and green boxes are the themes of the respective weeks, and in orange they are really the assessments that follow that particular week. So in week 7, for example, you're going to be getting Prof Liang, who will open up with anatomy IC, and then for Prof Wee and myself, we'll be taking you for the practical that we will teach you how to take blood pressure, palpate for pulses, as well as listen to basic heart sounds. And then by week 8, the practical will be taken by Prof Liang on anatomy, and the CLW will be taken by Dr. Lai and myself for the ABCDs of hypertension. By week 9, you will see Professor Wee appear in the syllabus, and she'll be teaching you on research methodology. The assignment here will be assigned to you by Prof Chui. And then by week 10, the practical again will be taken by Prof Wee and myself for the ECG. And there will be the appearance of our guest lecturer, Dr. Grace Chang, who will be taking you on the pharmacotherapeutics of antiarrhythmic agents. Now, by week 11, you're going to again get Prof Wee and I for the CLW, which combines heart failure and atrial fibrillation. And again, Dr. Chang will appear in this particular CLW to be leading you through the cases. And by week 12, you would see Dr. Wee, who will be taking you through chronic coronary syndromes, or CCS. And then by the final week, you will see Prof Wee and myself appear again for the CLW. So, cardiovascular science is really a pharmacotherapy playground, and if you look at the classes over here, just for the 2 themes of hypertension and heart failure, you will see that there are many classes of drugs being used for CVS. And these drugs will repeat themselves in heart failure, and that's why the both topics are like preferably back to back, and they write upon the other. The goals of therapy between the two will be very different, and then we'll be talking about that during the lecture. We'll also be talking about guidelines and how to apply which drugs to use and how would you choose these drugs according to your patient. The other themes like hyperlipidemia and CCS, as well as anti-anginal agents and cardiac arrhythmias, are a completely different group of agents, and you can see that the medicines here are really a lot. So this is what I enjoy most about cardiovascular medicine, really, the fact that there's so many medications involved, but yet, you know, the same few medicines can sometimes be, well, recycled for another particular condition, and thereby it implies that you really need to be knowing your medicines very well. So some polls for you, and that is to follow the schema closely of the oversight as well as the learning flow inside Luminous. Always be prepared to participate in the pre-activity readings and videos. That's critical because it's meant to be put there to prepare your minds for the actual activity that's going to happen for the particular session. Now, ask questions as you go along. Use the forum function in the Luminous. And for the integrated curriculum, you have to remember that we are trying to make you connect the dots between the modules and between the years. So I would hint to you now that the BP taking skills are extremely important, and you might actually see them again being well tested in the skills module. So the learning flow in Luminous has been enabled for you. If you can see above here, the weeks are numbered out for you. Not all the content is up yet, but we will definitely try and get everything up for you, particularly the pre-activity learning by the 3rd week of the semester. So this is a week 7 to 12 as seen here, and this is the oversight grid where you can look at the themes and then all the ICs and oversight in one grid in the front page. And the learning flow is by weeks, whether it's going to be integrated classrooms or the links or files are all in one place. So this is an example of how IC2 looks. So the IC and associated info is right here. The Zoom link for IC2 is here. And then the practical information is also there. And this is actually an example for week 7 of your activities. So this is another example of week 8, and this is to do with IC4, and that's the one that I will be taking you at. Again, you can see that the associate information is up there, and for this particular example, you can see that the pre-integrated classroom material, and this is video. This is going to be reading material. Now, not all the information is up there. This is actually being put up for you to know how the whole situation and layout is going to be like. And again, the Zoom link for IC4 is over here. So if you want to look for the various folders and files, then you can look into the file function Under the file function, I have actually split it up into 5 different folders. In the module information and details is the module booklet. So you have the same thing as your oversights in front, but more details about each of the ICs and each activity with the breakdown of the learning outcomes. And then file 1 is really about e-learning and pre-session prep, which is what I mentioned earlier. That is the pre-activity reading up or preparation. And then the second file there, labeled as number 2, is really on interactive classes, and that's going to be the slides. Okay. And then for number 3, that is really the collaborative workshop readings as well as material, and that's going to be for you to prepare in advance. And for folder number 4 is really about the practical material and the booklet that you're going to be getting for your practical. Alright, so this is the Luminous forum page, and this is really the preferred option because then whoever asks those questions, the rest of the class can also read and learn from the discussion on the forum. So you may post the questions to the faculty here. You may also subscribe to the post and upvote, etc. Those who know the answers can try to respond first, and if needed, we can always arrange for consultations with the faculty. This is an example of how the consultation page is like, and essentially it's for you to say book time with the respective faculty if you're interested. For those who are really shy, you can always just email the faculty, and here an example is to email me, and this is my email address. Again, I would say the preferred option is to go on the forum just so that some of these FAQs or commonly asked questions can be discussed and the whole class can benefit from the discussion. Alright, so it just leaves me to welcome you to this particular module. I know you're just going to enjoy yourself very much in this particular module, and I'll wish you all the best in your journey for this particular module. Thank you very much, and I'll see you soon.